Morning, everybody. I think we're going to get started. Thank you for joining. This is the monthly seminar of the ICN network, and I need to first also just point out that you can become members of the network if you are not already a member. And the seminar is being run by Lisa Bowden and I, who you've met before. And the focus is on the social science and policy side of the network. So I will just also say to you that we are recording sessions, so you would have seen that pop up. Okay, so I'm going to start by just briefly introducing the topic and why we've decided this would be an interesting discussion for our network. And then Lisa Bowden will introduce our three panelists. We're running a panel today, and we'll start with short presentations of their work, and then we'll have a focused discussion and then an open discussion. And you can also add questions and comments in the chat, and we'll try and pick those up as we go through. Okay, so just to start, so just over a year ago, we had a big day-long meeting when we launched the network, and both Lisa Bowden and I noticed that several members of the network from different disciplines had been involved in various engagements with policymakers during the COVID-19 pandemic. And so we thought it might be interesting at this point a year on to get some reflections on pandemics and policy, and particularly some reflections also from academic social scientists on engagement of research with policy during COVID-19 and thinking also forward with the focus of this network on coronaviruses and into the future. And we were particularly interested in trying to surface some discussion around the sort of political environment of policy advice, or what in the social science we might refer to as the politics of knowledge. And it seemed to us that the COVID-19 pandemic had really sparked this renewed interest in and debate about this interface between science and public policy. But there were a lot of political dynamics that played out and that really characterized these spaces for advice and decision making. And of course, during COVID-19, these played out amidst a sort of urgency of crisis. There were multiple and ongoing uncertainties. We saw this deepening of long-standing inequality. And of course, there were sort of ideological divides that emerged also between different politicians and policymakers. And obviously, in that context, there was quite a balance of disciplinary expertise that was requested. It tended to the side of epidemiological modeling and clinical and laboratory science disciplines. But we noticed that in that crisis, quite often people tended to work in silos, and there was kind of less opportunity to really integrate evidence and expertise across disciplinary silos. And so social scientists were also involved and pulled into those policy-making bodies. They were also on national scientific advisory groups, such as the UK-SAGE, or co-opted into advisory roles for UN agencies. And some of us were involved in social science groups with WHO, for example. But it was often quite difficult to really get interdisciplinary conversations going with colleagues from other disciplines, and indeed difficult to actually reflect on some of the sort of difficulties of operating amidst these political dynamics, or the politics of knowledge. So we thought it would be quite interesting today just to try and discuss some of that a bit more with all of us in this network who might have done that kind of work. And so we've asked three very well qualified panelists of social scientists at different career stages, and our panelists have all participated in some way, either in these national advisory committees or engaging with local councils in the pandemic, or even reflecting on this politics of knowledge. So we're going to start by asking them just to briefly speak about that work. So we'll have three short presentations of about 5 to 7 minutes, and then we're going to invite more explicitly their reflections on that role as social scientists in pandemic response and how the politics of knowledge might have manifested in engagement. And hopefully we can answer some of these questions about voice and power within and across academic disciplines, questions about whose knowledge and experience were shared and heard in those debates, but also more broadly in the space at the intersection of science and policy. And we hope that you can then also feed in some of your own reflections and experiences. So I'm going to hand over now to Lisa Bowden to introduce our panelists. So you will then do their short presentations, and please do put your comments into the chat. We'll hold off a bit taking questions on content and try and start our panel discussion focused on these issues around policy and policy advice. So I'll hand over now to Lisa Bowden.
Thanks, Hayley. Yes, it's a real pleasure to have with us three distinguished panelists. We have Professor Laura Baer, Dr. Megan Schmidt-Sane, and Dr. Joshua Moon. So I'll introduce all three of them first before inviting Laura to start with the presentations, just to give you a bit of background. So Professor Laura Baer is an anthropologist of bureaucracy and the economy. She carries out long-term fieldwork in the UK and India, and during COVID-19, she was a member of the Behavioral Science and Ethnicity Committees under SAGE, providing advice on issues of inequality in relation to government health measures and disease outcomes. Her evidence impacted policy design by a range of bodies, including the COVID-19 Strategy and Operations Committee in Number 10, Public Health England, the Ministry of Housing, Communities and Local Government, and the Government Communication Service Behavioural Science Unit. And she's currently involved in a Europe-wide ERC-funded project called Periscope that addresses the different forms of governance and policy that could lead to recovery from COVID-19 and preparation for future pandemics. Our second speaker will be Dr. Megan Schmidt-Sane, who is a research fellow at the Institute of Development Studies, and she's a medical anthropologist with interdisciplinary training in public health. During the COVID-19 pandemic, she worked closely with the colleagues at Social Science and Humanitarian Action Platform, SSHAP, to rapidly translate social science and insights into COVID-19 policy and practice recommendations, for example, in Ealing, West London. She's part of an engaged research partnership with Ealing's public health team, voluntary and community sector organizations, and youth services that is working to translate community insights into policy to improve health equity. Our last speaker is going to be Dr. Joshua Moon. He's a science, technology, and innovation studies researcher with expertise in project and program evaluation, sociology of scientific knowledge and policy making, and policy analysis. He's worked on the policy responses to various diseases, including Ebola, COVID-19, influenza, and HIV. And during COVID-19, he developed a close working relationship with the International Comparators Joint Unit, providing evidence of international best practice on COVID-19 testing to the Cabinet Office. So he's currently working on a project with the FCDO on artificial intelligence and biosecurity, as well as developing the third high-level implementation plan for the PIP framework. So I'm going to invite Professor Baer to share her screen and begin her presentation. And just to remind everybody that if you have any questions, you can pop your questions into the chat box as we're going along, and we'll try and pick those up at the end of the discussion, or potentially as we're listening to the speakers. So thank you very much. I'm handing over now to Dr. Laura Baer, Professor Laura Baer. Thanks, Laura.
Thank you very much, Hayley and Lisa. I'm really looking forward to everyone's questions, and thank you so much for organising this opportunity for me to speak. I'll now share my slides. Great. So it's very interesting that Lisa mentioned the process of translation that's necessary as social sciences move into policy arenas, particularly policy arenas around COVID in this case. And what I'm going to talk to you about now is a kind of term and a way of looking at things, a way of evaluating policy that enabled me to, in a sense, translate anthropology's insights into inequality and disease outcomes into the language of other disciplines and into really in a way that would allow policymakers used to a more behavioral science individualistic approach would start to understand the complexity of social relationships and how they impact on both reception of COVID policy and also disease outcome. So this kind of translation term that I used during my time on SAGE was a social infrastructure approach to pandemic interventions. For the anthropologists who may be in the audience, you may think of this term as social infrastructure as being a particularly militaristic or neoliberal term. But what I was doing by using this term was I was using a term that sounded familiar to people and gave social networks and social relations a validity as important as that as infrastructure, but to also bring in a kind of critical perspective on government policy. So what I'm going to begin by doing is to take you inside this social infrastructure approach that actually proved very effective within my work in SAGE. Now, at the heart of this social infrastructure approach is an argument that pandemic interventions should be evaluated not only in terms of disease outcomes, but they should be evaluated using what I call a social calculus. So what that means is that you evaluate pandemic interventions in terms of their impact specifically on marginalized groups. You focus on the outcomes for them as the most disadvantaged in society. And you also focus on the impacts that pandemic interventions might have on their networks of care and support, both within families and communities, and the ways in which those join up with formal forms of care and support from local authorities and government. And this is an approach that I developed collaboratively with the LSE COVID and Care Group, and we have a whole series of reports that you can go and look at if you're interested in this. And I'm now developing this further collaboratively with the Periscope project, which will hopefully help us to understand how to prepare for future pandemics. So let me talk a little bit more about what these social infrastructures are. So these social infrastructures, according to the anthropological perspective, are the networks of relationships in which people are embedded, those of home that stretch between homes and sort of generate community as a process. And it's also within these social infrastructures is a questioning of the relationships between these, what we might call informal networks and more formal institutions, health or political institutions. So there's a kind of sense in which the nature of these how these social infrastructures are formed is related to the kinds of institutions that surround people. And the social infrastructure approach particularly focuses on the process of social connection and disconnection that these infrastructures generate. So it includes an analysis of relations of stigma, relations of trust, how and when they're generated, and even relations of hope that enable people to engage with collective health measures. These relationships, because these are fundamentally relationships, they're not things that exist out there, they're relationships between people within society, involve both mutuality and forms of exploitation in the workplace community and within groups. And they also include, perhaps surprisingly for the term is social infrastructures, they also include relations to the non-human. So by that I mean the built environment and the relationships to disease entities themselves, like the COVID-19 COVID-19 virus itself. Now, these social infrastructures, and anthropologists would argue, impact on both health disparities and situations of enduring transmission, which sort of were generated within the UK during the COVID-19 pandemic. These are places where COVID is endlessly circulating, whatever measures are taken. They also affect how policies, top-down policies, land, what they generate, and whether they generate unintended effects. Just going a little bit deeper into these social infrastructures. So these networks within and between families involve both care, positive relationships, and forms of kinship or moral values, but also kin work, a labor of care. And this is really crucial because once you label them as a labor of care or labor of creating relations, question arises of how you're going to provision those from within society and by the state. They're also founded in ethical values, and they involve burdens, ambivalences, and inequalities. And we found a lot of those during the COVID-19 pandemic in terms of the burdens placed particularly on middle-aged women to care for the elder and young children, but also on young adults carrying out a similar role. They also involve networks within and between communities, which will have a goal of mutuality, but also involves internal divisions and inequalities. And the individuals are members, importantly, of multiple communities. Government thinking often thinks of people as being statically members of a particular ethnic or social group, but community is a process and it's a relationship, and people can engage in that in multiple ways and in multiple forms. Now, what's crucial here is that, particularly due to austerity policies or what might be called broadly neoliberal policies across the world, have created a situation where the socioeconomically disadvantaged and the minoritized rely more on these informal networks to get by than other groups. And they're also in relation, obviously, to the most degraded non-human environments. Now, what's crucial here, as I may have already said, is that institutions, policies, and resources shape these social infrastructures. They're not just out there to be tapped into. Networks are impacted by policies and socioeconomic conditions. And crucially, if policies don't take social infrastructures into account, it can have unintended negative effects. You can introduce policies that might contravene people's core values. They might appear immoral, undermining legitimacy. They might not even make sense. They also if you don't take them seriously, it can potentially undermine coping mechanisms or intensify inequalities within them. And policies could also create burdens. Some things that the state should be doing are pushed on to communities. Now, if you do take these into account, then potentially you can build co-production, more equal relationships between policy environments and society. You can generate better distributive outcomes and a legitimacy for policy, and ultimately better disease outcomes as well. So how does this work in practice? I'm just going to very briefly gesture towards three policies or three areas in which I used this social infrastructure approach in the coronavirus response in the UK. The first of all was to push from March 2020 for the formation of support bubbles as we came out from the first lockdown. Support bubbles were a policy that was first generated within New Zealand and Canada. But what I started to do is, as we came out from the first lockdown, I started to argue that the first kind of relationships and first kinds of encounters that should be prioritized as we opened up, and that should still be prioritized when we went into further lockdowns, were relationships of social support and care within households. Now, the way to do this was to enable growing amounts of support bubbles, or sort of support bubbles that would enable relations of care to be generated and to continue. And these would in particular be signaled within policy as being not just about socializing, but about relations in order to help the elderly, carers, disabled, and extended families, particularly the extended families of minoritized and excluded groups, because they rely particularly on these relations to get by with the labor of care. Now, this policy was taken up by the government for lots of very interesting reasons, which also includes political controversies at the time, particularly in May 2020. But it was also taken up because it would also signal that the government was acting in an ethical way. It wasn't just prioritizing the economy as we came out of lockdowns. So actually, this was very effective. By August 2020, 44% of UK residents reported to the Office for National Statistics that they had formed a support bubble benefiting from the policy. And during the second lockdown, these bubbles were widely used for family support relationships and childcare, especially by women. The second way that this social infrastructures approach was used in the coronavirus response was in relation to the first centralized national community health initiative by the UK government, which goes under the name of Community Champions. Now, I worked with particularly Atia Kamal within SPI-B to argue for public health initiatives, which really would enable some of the initiatives that local authorities had already started to generate, which were around getting communities and community groups involved in the dissemination of public health information around COVID, and then later on around the uptake of vaccination. Now, Atia Kamal and I have been following the emergence of these experiments in community initiatives across the UK, and we've been working very closely with local public health teams who had kind of initiated these. And we took the information about how these worked into a policy paper, and we also looked at global examples as well. And then, interestingly, a department in government that we hadn't expected to take this up the former Ministry of Housing, Communities and Local Government, became very interested in the potential role of community networks for disseminating health information and how to help how to kind of amplify these and direct resources to them. We'd expected the NHS in particular to get interested, but it was actually this other ministry. So Attia and I then worked with them to formulate this policy and to think of ways you could generate a very generous abundance of funding along networks with not too much audit in order to create lots of experiments in community initiatives. Now, this policy was launched in January 2021 with £23 million of funding, targeted at 60 of England's most deprived areas, particularly areas that hadn't already started these community champions networks. And these didn't just, we found, Attia and I, when we evaluated these didn't just generate a greater uptake in vaccination rates, a statistic that's lower on the slide, but they also created a more cooperative situation in the middle of the COVID pandemic, when multiple forms of community groups across normal boundaries of communities started to provide mutual support and information to each other. So these groups were coming together to create vaccination hubs in mosques, for example, but they were also putting health information into food parcels as they were distributed within the communities. And they also, the organizations were also mutually advising each other on how to create a useful debt advice for increasingly indebted people within their communities. And so there was cross community group collaboration as well. The other way in which I attempted, so that was again very effective use of the social infrastructures idea, but I'm now going to tell you about a less effective one, and maybe we can talk about in the questions why this was less effective and why it wasn't taken up within policy. We found out and we saw an increasing trend in the second wave from December 2020 to January 21 of a very differential mortality within ethnic groups in the second wave. So in the first wave, there had been a high mortality rate from COVID-19 for all ethnic groups within the UK. But in the second wave, it was actually highest for Bangladeshi and Pakistani groups. So I led a group, a cross-disciplinary group that was trying to look at the social reasons for this quantitative patterning. And we found out actually that this was, not surprisingly perhaps, but it was surprising perhaps to the government, that this was due to the amplifying intersecting effects of health inequities, sort of comorbidities, health inequities over time, disadvantages associated with occupation and household circumstances, the fact that businesses that Bangladeshi and Pakistani groups were in were family businesses, and small businesses like taxi driving that were not supported by the Treasury's sort of support scheme for businesses, also continued during the lockdown, so people were more exposed. There are also barriers to accessing care, stigma, in particular stigma that have been generated directly by the government, particularly around the May 2020 calling out of multi-generational households, particularly Muslim households, for apparently causing waves of disease transmission. This then created stigma for these groups, which meant that they were less likely to access healthcare. And we also looked at the potential influence of policy and practice on COVID-19 health-seeking behaviour, the ways in which it had stopped that health-seeking behaviour and how in the future it might support it. So unfortunately, the recommendations for these interventions did not get taken up by the government, and we could maybe talk about in the questions why they didn't. So what I'm generally saying overall is that we need interventions that take these social infrastructures into account. And this is because social division, trust and stigma intersect to produce health effects. So initiatives that communicate solidarity and work with social infrastructures are important. And also it means that if you take this into account, then you generate pragmatic interventions based on local understandings and real problems of access to health, particularly in relation, in my case, to vaccination. You also create national level interventions that take community and household networks and their sustenance into account. You also need to recognize that you need to provide central government resources to support these infrastructures and build them over the long term in order to support ease of access and health-seeking behaviour. So the overall argument that I'm taking away from this experience of using the social infrastructures idea is that we need investment in social infrastructures for the next pandemic. Thank you for listening.
Thank you so much, Laura. That was a fascinating presentation and lots of things really, especially towards the end there, that I'm sure that people will be very interested in picking up with you, either just in the chat or in the discussion. We'll move now, actually, if I can, to introduce Dr. Megan Schmidt-Sane. Megan, are you happy to share your screen and
Yes.
go over the presentation? Thanks again, Laura.
Thank you very much, Laura, for starting us off, as well as for Lisa and Haley for organizing this. So I will kind of build on what Laura has shared, but I will focus very much in on a specific example of work that we've done over the past couple of years in Ealing, West London. So I will also kind of share more methodological reflections. So this really built on my work and engagement with the Social Science and Humanitarian Action Platform, or SHAP. And that is a program of work based at the Institute of Development Studies with Anthropologica and the London School of Hygiene and Tropical Medicine as well. So this program of work really broadly focuses on the social dimensions of emergency response. And it follows in a long tradition of anthropological engagement in epidemic response. And the same kind of questions that I know that we'll discuss later kind of emerge in terms of to what extent can we as anthropologists or social scientists be critical? Can we retain that kind of critical social structural lens while also engaging with policy, or are the two necessarily in tension? SHAP's work is also to encourage emergency responses, which are effective, adaptive, contextually informed, and sensitive to vulnerabilities and power relations. There's also this priority of planning and consultation with affected communities and local institutions, and really bringing together social and interdisciplinary science and evidence. So the work that we've done in Ealing really built on SHAP's kind of model and program of work, which has kind of honed the ways in which social scientists can engage with emergency response. So kind of stemming from that work, my colleagues who could not join today, Santi and Tabitha, as well as the wider SHAP group, were asked to kind of bring together a piece to understand the wider context of vaccine equity in Ealing, West London, which is a borough that is extremely diverse with long established South Asian communities, as well as East African, and it's a really diverse kind of borough. So they conducted a review of literature and several informal consultations with local actors involved in COVID-19 vaccination efforts and the community as well, in order to kind of build a picture of and contextualize COVID-19 vaccine uptake in Ealing. And so this report really highlighted a lot of the key contextual issues in Ealing that were shaping vaccine uptake and vaccine engagement. I mentioned that it's a extremely diverse site, and a lot of the vaccine uptake as well as engagement was linked to longstanding issues of racism and structural inequalities in the community. So the council and our partners in public health were very much open to the report, and this kind of led to several other forms of collaboration over the past year or so. So around that same time, the council had also commissioned a racial equality review and report. So there was a lot of openness, I think, that just created enough space for us to also bring that kind of anthropological social science lens. So around that time, we worked with their public health team and received and worked on two projects. One was looking at local government's response to COVID-19 vaccine engagement in a comparative view, comparing Ealing's work with Marseille and Toronto. And then the second one, which I'll talk about, was one that I led, which was using youth participatory action research methods to really kind of bridge that gap between youth experiences and youth views and COVID vaccine engagement. So our YPAR project really sought to understand the detailed kind of place conditions. So not only the kind of place conditions of Ealing, but how that was nested in this wider context or wider political economy of, a history of austerity and policies that have really kind of shrunk the youth services space over many, many years. And so the way that this kind of relationship had emerged had really set up the way that young people kind of responded to and engaged with authorities more widely, including public health actors. So we were kind of hearing some of this from our collaborators at youth services. And so we came up with these research questions that really looked at kind of that political economy, as well as the impact of systemic racism and other structural inequalities that kind of shaped how young people's experiences affected how they viewed COVID-19 vaccines and how and when they trust in authorities, including public health authorities. So this was very collaborative work. We made sure to stay in touch with our partners in the public health team, the vaccine working group at Ealing, as well as youth services. And so we have a collaborator in youth services who really co-designed and kind of managed and ran the project with us. We also worked in partnership with a couple of different youth centers, including one which had been really at the forefront of using the arts to kind of create a way for young people to express their lives and their experiences. And this is an example in the photo of an exhibit that they actually put together at the Pittshanger Gallery in Ealing that really highlighted kind of the wider political economies and experiences of systemic racism in Ealing and the impact it's had on youth. So a lot of our kind of work was already done for us in the sense that, you know, there was already this really good kind of awareness of youth experiences and kind of what they were facing. So what we did is we created a youth advisory board. We worked in partnership with this youth center. We did a lot of really foundational ethnographic work as well. We conducted interviews, group discussions over several months. And together we authored a comparative case study with our other sites in Cleveland, Ohio, in the US, and then a very Ealing-focused case study. And so we worked with our partners in youth services to disseminate this quite widely, primarily amongst the public health audience in Ealing. And so this culminated in them asking us to conduct a workshop with the vaccine working group, and other public health staff were also invited to really kind of go deeper into the findings of the work, but then to also kind of co-create or discuss specific policy and practice recommendations. And some of our work was, over this entire collaboration, informed actually what they proposed to do under the Community Champions program that was mentioned earlier. And so that is one thing that came out of that. And so we've continued kind of working together, and we just are starting a new project that will use this kind of intergenerational approach. So it's still very youth-centered, but more widely using what we've done so far to kind of continue to build that consortium to improve health equity and integration with the integrated care system. So there are some opportunities there to continue to build bridges between health and the voluntary sector. Okay, and that's all that I have for now. I'm happy to discuss this further. Thank you very much.
Thanks a lot, Megan. That's great. And in the interest of time, I'm going to say thank you to you and to invite Joshua, if you can share your screen and give your presentation. Thank you.
Great. Thanks, Megan and Laura, for those really interesting presentations. And thanks to Lisa and Haley for inviting me to talk. I'm going to be, I guess, a little more focused on a particular experience that I had working with the International Comparators Joint Unit, which was a joint collaboration between the FCDO and the Cabinet Office to provide examples of international best practice during the COVID-19 response in a way of better understanding differences between countries and how they've responded to different challenges. As a quick kind of overview of my background and some of the research that I've done, particularly of relevance to COVID-19, my initial PhD looked at lessons learned reports as a nexus for global health politics. So looking at how different interests, different knowledges, particularly social versus technical knowledges, are amalgamated into these large lessons learned reports, like the IPPR report that WHO is now attempting to assimilate into its own program of work. More commonly or more relevantly for COVID, I worked on an international research project across 8 different countries on 3 continents called Optimizing Coronavirus Testing Systems, looking at how diagnostic testing was used and implemented across different national contexts. And I was also leading on an evaluation of an Ethiopian network of neglected tropical disease researchers who were encouraging policy uptake, but in particular during COVID, when physical interaction was particularly difficult. And so getting onto people's agendas and radars, particularly if you're not studying COVID at that time, was particularly difficult as well. And so these are some of the experiences that are informing this. In terms of research engagement, a lot of the things I've done are kind of media commentary and submissions to various government committees. The reason I emphasize this is because this is part of the almost shouting into the void experience that I think some of us had when it came to trying to influence or in some way shape policy responses to COVID-19, particularly as both an early career researcher and a social science researcher. Those were not necessarily the expertises that were actively sought in many places, particularly around COVID response. And so there was a lot of experience in there of kind of having these thoughts, having these ideas, and being able to verbalize them and formalize them, but not having a way of truly feeding them into policy responses, partially because you don't have those professional and personal networks as an early career researcher, but also you don't have those relationships with policymakers as with technical policymakers, more accurately, as a social scientist who hasn't been working in the area as long as some others. But we did manage to, as part of this international project, build a relationship with the International Comparators Joint Unit. So we fed into multiple reports that went to government ministers during the COVID response. We also worked with the UK Health Security Agency and BEIS on a review of international best practices on in vitro diagnostic testing, particularly focusing on those rapid antigen tests, and thinking about the market and the privatization of those kind of testing systems. And then more recently, we're currently finishing up a joint project with the Pandemic Influenza Preparedness Secretariat at WHO on how their high-level implementation plan is going to draw on some of the lessons and experiences from COVID and integrate them into pandemic influenza. All of these have brought up very similar relationships between technical and social knowledge, and kind of how these knowledges relate to one another and are integrated. And so I wanted to provide just a very quick anecdote that actually I think links quite well with Laura's query around enduring transmission and potentially why some of these things may not have been picked up as well. So as part of our work with the ICJU, we were asked to discuss and provide international best practice on how different countries were dealing with these areas of enduring transmission. So as Laura probably more succinctly put it, these are areas where COVID transmission tends to just keep going and keep going through intersecting racial, societal, political factors, all kind of forming this vicious cycle of continual COVID transmission. And so in the beginning, we had quite a reasonable discussion. I think all of us on the Ox team are, for the most part, social science researchers. So when we saw the questions, our first instinct was to question the questions, question the framing. Why are they framing it in this particular way? And that was something that the ICJU and the policymakers were quite receptive to, this idea of us questioning how they were framing their policy responses. But then once it came to evidence gathering, once it came to evidence analysis, that openness slightly shifted. So because the report was going out to various different ministers on slightly different topics, because the data collection, the data gathering, the data analysis had to address so many different policy areas, the topics weren't just on enduring transmission, but they were about genomic surveillance, variants of concern, how isolation was enforced, how well compliance was measured around isolation. And then importantly, the turnaround time for all of this was less than 2 weeks. So between us questioning the framing of what the report will be and trying to get a sense of what the assumptions were, and then actually submitting our evidence for them to turn this around, that was about 10 to 12 days. And although in the end it did produce a report that did discuss some social measures, that high-level international comparison was diluted to an extent by a series of kind of technical solutions and considerations around genomic surveillance, variants of concern, and ideas around enforcing isolation rather than facilitating it. And so all of these solutions were ultimately more easily implemented and more easily taken up by policy, rather than the kind of more general social approaches to tackling areas of enduring transmission. I will note that some of the options we provided were eventually kind of taken up in terms of targeted screening, direct provision of mobile testing units. All of these were examples we'd found, particularly in Ireland and Spain, were examples that we had offered up. But in terms of reflecting on that experience, that policy relevant engagement feeling like shouting into the void is very much around this idea of specific problems that need addressing, but specific problems recognized by policymakers and on a particular agenda. And importantly, when you are talking to kind of the scientific advice arm of policymaking, there is often a need to speak to multiple decision makers. And so topics will compete for attention even within the same kind of project, within the same reports, within the same context. And then finally, those tight turnarounds mean that you don't get a huge amount of time to collect data, to analyze that data, and really kind of interpret and interrogate the social context of that data and the implications of the analysis you're finding. And so importantly, from a kind of high-level science policy perspective, most of this, in fact, all of this, privileges those technical knowledges rather than the social knowledges. And so this fits in quite well with the other research that I've been doing around how actually the process of policymaking, the process of analysis, isn't just a question of power, or a question of how different knowledges are respected and given particular authority and credibility, but also that very process privileges technical knowledges. And so for me, that's also a core part of this, is in emergencies, particularly that tight turnaround and that multiple decision-making perspective really kind of constricts the space for that social and that discursive mode of thinking that I think we social scientists in particular are very used to and prefer to use effectively. And so I think that's my core reflection, is actually the process itself needs to be adapted to either enable social science to fit into this space, or social science may need to have some adaptation to be able to fit into those policy spaces. Thank you.
Thank you so much, Joshua. Thanks very much to all three of our speakers. They're really rich presentations. There's a lot of information in there, and I'm looking at the time and realizing that we're not going to get to many of these questions, but I'd love to really open up the discussion with a simple reflection, which I hope I'll come to all three of you, or you can come in at different points, around what you felt your personal, to kind of move it along from your personal reflection, which you ended on so nicely there, Joshua, around what was and what wasn't achieved. So what worked really well in terms of the delivery of this type of evidence into policy, but also what is the challenge then for integrating those social sciences into policy development, but also into the interdisciplinary working. We're mindful that many of the people who are on this call might be coming from those technical approaches and looking towards the social science to see how to better collaborate. So I'm going to open the floor here, and just also there's a number of questions in the chat box for Megan and for Joshua in particular to answer, but maybe I can start with you, Laura, and if we can be just mindful of the time, just a succinct kind of maybe a one sentence so that we can make sure that we can get to people who are in the room who probably have a lot of questions for you. Laura, do you have some thoughts on where to start with that sort of pick up from your presentation and the others?
Yes, so I think the context, I mean, the reason that the context in which social science advice worked, surprisingly perhaps, in my experience, was the kind of, we had alongside my work, we had this team at LSE who kind of gifted their time and were producing kind of real-time engagement with disadvantaged communities, particularly in the London and Midlands, who they've been working with for a very long period of time. It wasn't just a kind of swooping in and gathering up evidence, it was sort of long-term relationships of research. And I found that there was a deep recognition of the validity of that kind of evidence, and it usually matched up pretty much with the sorts of data that the ONS was picking up. And the context in which it was used was usually when you can have as much quantitative evidence as you want, either from these national surveys or ONS studies, but you can't actually explain the patterning unless you bring it into relation to the social science evidence. So that's kind of that's the context. So to help quantitative disciplines, to help epidemiologists and modelers to understand the reasons why things are happening, and to put that in relation to the apparently technical solutions that as Joshua said, they seem to be the easiest solutions, but when you can't explain things, you need to bring the social scientists in. And the context in which it didn't work were really in relation to the government not accepting responsibility for certain social processes. And I think that's why technical fixes seem to work and there's a sort of veering towards that. So we had a government that did not accept responsibility for structural racism, did not accept responsibility for austerity, did not accept responsibility for local authorities' abilities to act being hollowed out financially. And that was usually the barrier. The other kind of barrier, it's crucially, politics and ministers fundamentally decide what happens. And what I've suggested to the COVID inquiry is that there's a lot of discussion of the responsibilities of scientists, but there's no discussion of the responsibility of the government to follow scientific evidence. And I hope that the Commission doesn't turn into something that's just talking about the responsibility of scientists.
Yeah, Laura, that's fascinating. Megan, do you want to pick up on anything that came out of that from your own experiences too? I think there's some interesting kind of transition between the three speakers, in that some very formal approaches to which you can engage, and then Joshua's picking up too about how maybe when you're starting, if you don't have a formal pathway as well. Are there things you want to say about that, Megan, to you?
Yeah, sure. And thank you, Laura. Again, you really nicely framed kind of what the issues are. And we saw this very much play out in Ealing. So while the local council's public health team was very much aware of kind of these wider structural issues and the impact of austerity, for example, on what work they could do, I think there was this sense that, that their hands were often tied. And yeah, there was just a sense of, what can you really do in the here and now to dismantle systemic racism, right? And so that became kind of a challenge. But I think that they did find ways in which they could start to mitigate or unravel some of those impacts, for example, through the Community Champions program. But I think one major challenge which we faced was that of sustainability. So a lot of our relationships are with specific individuals within the public health team. And there's a lot of turnover. There were a lot of resources that came in during COVID-19 that have now kind of gone away. So a lot of the funding that was there, that was kind of injected into the public health team's work during COVID, almost created space for these kind of new ways of working, but then now a lot of that is gone. So how do we make this kind of impact sustainable? And yeah, I think also I'm happy to reflect more on just the impact of austerity that we saw locally, because the way that it has affected youth is just to really create this broad sense of distrust in authorities, including government institutions and so on. So thank you for raising that.
Yeah, thanks, Megan. So kind of an interesting point there around knowledge brokering and the shortening of these pathways between scientists and policymakers in emergencies, which sort of needs to be funded in the longer term. And there are definitely places which are doing that. Joshua, do you want to comment on and come in on that before I hand over to Hayley?
Yeah, I think that's absolutely right there from Megan, is that there's this sustainability of those connections. So the ICJU doesn't exist anymore, at least not in its kind of its prior form. And all of the individuals who we worked with quite closely aren't just in different government departments, aren't just in different policy areas, but importantly have different email addresses. And so it makes it really difficult to get back in touch with them because their email address changes when they move to a new government department. And so there's really that, even these tiny changes in process of a long-standing sustainable email address for a civil servant is something that has a quite large impact on the way in which we as scientists and academics can continue to engage in policy if we've built up a relationship during an emergency. And I think that also kind of partially connects with some of the questions that I've been seeing in the chat on this connection between politics and the anti-vax and the COVID origins and some of these issues. Is you can do everything you want in an emergency, but if you haven't built and sustained that trust prior to an emergency and you don't continue that trust after an emergency, then everything that happens in that kind of self-contained, isolated event isn't going to matter. You can build it all you like, but you have to make sure that it's robust enough to continue over time. And so I think both in terms of policy engagement and in terms of community engagement, that's where the kind of key trick lies. It's sustainability, not just pumping resources in an emergency.
Thanks, Joshua. Hayley, do you want to pick up?
Thank you. So sorry that we've run a bit short of time. We'd hope to have some time to really get into your questions, which are wonderful. Thank you. So please, for the audience, do just post, and at least it gives us some sort of sense of what your response is and your experience. So I think we've had some really interesting presentations, particularly also bringing out this point, as Laura put it very well, the social infrastructure, not just the individual behaviour. So I think we were also trying to give a wider sense of what social science can contribute in this process. And I particularly also appreciate the raising of this question of responsibility. And I think that relates in an interesting way also to some of the questions in the chat, where several of the audience are raising the issue of internet and what WHO is calling infodemia. And I think, because we don't have time to go back to the panel, Megan has responded a bit on that, because I guess this wider question of the social context into which technologies, but also information land, really matters. And so I think a lot of what we've been discussing, the wider politics of trust, marginalization, inequality, really feeds into also how people receive messages. So I guess as social scientists, we would want to unpack a bit more this notion of an infodemic and give it a sort of, I guess, more robust rootedness in social and political relations. And I wonder if, just finally, yeah, Laura, thank you. I wasn't going to say you can just focus on trust, because I know Laura's colleague, and you preempted me, is doing some work on trust, actually, two of Laura's colleagues, and just to give trust that wider orientation, that it's not just trust in science, it's a wider set of relationships. And so I think as we, yeah, thank you, that's great. I think as we finish, just to thank our panelists, because I think what we really wanted in this interdisciplinary space was to talk about this policy space, but also to give these really rich examples of some of the opportunities and challenges of engaging across disciplines, but also bringing this sort of more long-term perspective on how policy responses happen, the effects of policy, but also to surface some of these questions about the sort of social infrastructure, social relations, and the widest networks of responsibility. So thank you very much, everybody, and hopefully on another occasion, the next social science seminar for the ICN, we can really dig in a bit further if you want to just come in. But thank you very much to our panelists. Lisa, did you want to also just say thank you?
Yeah, just to say thank you again very much to the panelists and everybody who's online, and for all of your questions. And agree, Haley, it would be great to get these speakers back perhaps for another follow-up session if they'd be willing, just to continue the conversation. It's excellent and fantastic presentations. Thank you.